Hello, my name is María-Fernanda Lorenzo-Gomez. I am a professor in the Department of Surgery at the University Hospital of Salamanca, located in Salamanca, Spain. On behalf of my co-authors, I am happy to present our work regarding bulking agents indications to correct vesicoureteral reflux during the first ever ICS online meeting. The presenter does not have any conflict of interest to declare. Vesicoureteral reflux is usually described as a congenital malformation. It can be commonly found in neurological patients with detrusor sphincter dyssynergia or high-pressure bladder. However, it can also be diagnosed as an iatrogenic situation after surgery or radiation therapy in both men and women, leading to renal dysfunction, urinary tract infections, and pain. The objectives of this study are to describe the profile of patients for intravesical bulge injections for the correction of vesicoureteral reflux and to report the result of this technique. We underwent a prospective study in 54 patients treated with Bulkamid to correct vesicoureteral reflux. The patients were grouped according to the origin of the reflux, differentiating patients with idiopathic reflux and patients with reflux due to interstitial cystitis, neurogenic bladder, radiation therapy, and tuberculosis. The variables studied were age, gender, body mass index, secondary diagnosis or concomitant diseases, initial symptoms, laterality, and the results after treatment. The mean age of the sample was 56 years, with a range between 19 and 79 years. Patients in the radiation therapy group were older than treated and when treated, and patients in the neurogenic bladder group were younger. 89% of the patients were women. Nearly half of the patients had a left reflux, and 18% had bilateral reflux. Abdominal pain was the most frequent initial symptom, appearing in 44% of the patients, followed by recurrent urinary tract infection. Treatment response was evaluated with a retrograde cystography 6 weeks after injection. Nearly 90% of patients had an improvement greater than the 50%. No vesicoureteral reflux worsening or complete failure was identified. The most widely used material for endoscopic injection in patients with vesicoureteral reflux is the flux, but there is growing evidence of the utility of Bulkamid in the correction of the reflux in children and young adults. Its biocompatibility and absence of migration, together with a lower price, make it an interesting alternative. Our study also has explored other causes of reflux, like tuberculosis and pelvic oncological treatment. If there is a suspicion of recurrent vesicoureteral reflux in patients with bladder pain syndrome, a follow-up voiding cystography should be performed. It is also the case of patients with radical prostatectomy or neurogenic bladder. If the correction of urinary incontinence is planned and the patient has already been diagnosed with vesicoureteral reflux, it is important to take into consideration that the reflux can worsen if not properly corrected. We conclude that the vesicoureteral reflux should be considered in patients with recurrent urinary tract infections or no specific abdominal pain without history or radiation therapy, and that Bulkamid provides high cure rates with a good safety profile. Thank you very much for your attention.